Hi, my name is Reyhan, and I'm a senior studying biochemistry with a minor in nutrition. This is my digital story. My community work history did not start until high school. My parents had not been active in volunteerism, so it was not until my friends talked about joining Club YS, now known as Volunteer Club, that I began volunteering. My original motivation aligned with my friends in that I needed it for college applications. I treated them as items that I could add to a piece of paper rather than personal fulfillment. I chose any event and organization that was available, such as shoveling and raking yards, running stands at events, and other activities I would not engage in outside of the hour or two I would be there. However, this started to change when I discovered the Interfaith Outreach and Community Partners, or IOCP Food Shelf, where I started my first continued engagement. I realized that food justice was a social issue that I enjoyed engaging with in my own time. Around that same time, I began volunteering at the Maple Grove Community Hospital in the intensive care unit to gain experience in a healthcare setting, which was a future career interest of mine. By 11th grade, I finally found 2 community work settings that I truly felt fulfilled in. Relating this to Parker Palmer's Let Your Life Speak article, she cited Frederick Buechner's definition of vocation as where deep gladness meets the world's deep need, which joins self and service. Engaging with food justice gave me that deep gladness that met one of the world's deep needs, food security. Additionally, I learned how community work can be a part of a career in medicine, which gave me hope that I continue this vocation lifelong. Yet, when the COVID-19 pandemic hit, everything came to a screeching halt. Both IOCP and my hospital volunteering shut down. At that time, I had joined my high school's National Honor Society. What was supposed to be a deeper focus on community engagement, they shut down nearly all events other than the ones with little to no human interaction. My favorite part about volunteering is the interactions I have with people I would never see or talk with otherwise, from all kinds of different backgrounds. I felt disconnected from my vocation and community service for a year or two. Thankfully, once I joined college, organizations started to return to normal for the most part. By sophomore year, I knew I wanted to go into medicine, so I continued healthcare service by volunteering at the emergency department at M Health Fairview on campus. But I still believe I needed to gain a deeper connection to community work and engagement beyond that during my shifts. Thanks to the honors program, I was connected to the Community Engagement Scholars Program. My minor in nutrition was the reason I was able to continue my interest in food justice by finding organizations such as the Food Group. The Food Group assists in directly fighting hunger in the Twin Cities by selling affordable, nutritious food to communities that need it most. My nutrition classes expanded my knowledge regarding other food-related issues in Minnesota, such as waste and ways that the general public can work to help reduce that waste and redistribute excess food to food-insecure areas. CESP also taught me how to make my current engagements more meaningful. One way is through my ISAP project, where I'm creating a floor plan and guide for volunteers in the emergency department. There is currently no map to orient new volunteers, and the ED is one of the most confusing layouts that is often shifting. Since nurses and staff are very busy, allowing newer volunteers to be more independent and able to complete all of the tasks will help both the staff and patients. Regarding my food justice work, I've been learning more about the current situation and ways to help out more. I'm expanding my knowledge to advocacy and understanding how it can help shape food policies regarding insecurity. I've been privileged in that my family has never had to worry about affording meals or wondering where and even if the next meal will come. Morally, I cannot keep reading about the worsening food insecurity crisis in Minnesota without doing something about it. Along that same line, in my future in med school and medicine, I've discovered that advocating for patients will compromise a large part of my community work. There is currently a large disparity in health outcomes among communities that future health professionals must tackle. I hope I can continue making my service more impactful for organizations beyond the time I am physically volunteering there. My time with CESP has given me the opportunity to learn what that entails and how I can apply that in any kind of service I am involved in. Who knows? Maybe my vocation may also lie in a totally different social issue. But if I limit myself to my current experiences, I will never find that inner voice. I learned that finding fulfillment can be a trial and error process. For this, I will need to feel comfortable being uncomfortable.